because everything we do is multitasking. And so while we're making cookies, we're also talking or we're singing. While we're driving, we're talking, singing along with the radio. While we are working a crossword puzzle, someone may ask us a question. While we're working, if we want to get back to work, we have to be able to work and talk at the same time. So it takes us back to a normal quality of life where we can interact with our environment using our hands, but also with communication. It's important for a patient to have the right expectations when starting to speak hands-free, because not every patient is the same. So it depends on the patient's history. How much surgery and reconstruction have they had? How much radiation have they had in the past? What is the anatomy like now that they've had their surgery? All of these things combined together will change the physiology of how the hands-free speech will work. And so if a person has too much pressure, not enough pressure, it's going to change how easily they can produce the speech. And so it's important for a person to have these expectations, to know that we can't just put the device on and they will be a fluent speaker. It may happen for some patients, but not for all. And I think if they don't have these expectations, then they may become frustrated or disenfranchised with the product and not try to use it. Motivation is absolutely essential in the development of fluent hands-free speech. If a patient is motivated, then they're going to work harder and they're going to try more times to make it work. And they're also going to accept recommendations as to what may make them more successful. We have to remember that every expert was once a beginner, and it's important for our patients to understand this as they try this new chapter in their rehabilitation. To make using a hands-free device more successful, the speech pathologist, first of all, should recognize that knowledge is power, knowledge is control, and knowledge is satisfaction. So the more a patient understands about how a hands-free device works, then the patient will be more successful. They'll be more willing to try different strategies and techniques. So I think that the SLP needs to educate the patient about the anatomy and the physiology and the benefits of using hands-free speech, but I also think the speech pathologist should work with the patient to learn behavioral strategies in relaxation and phonation, easy onset phonation, teach them attachment strategies, whether it's with an intraluminal device, whether it's with an adhesive base plate, help the patient find the most efficient way to use the free hands device.